Britt, 57-year-old bioengineer, loves being outdoors and skiing. Married with 2 daughters, Christine, 29, Lena, 27, and a 6-year-old grandson, Matthias. Used to love getting into the mountains, but over the last 10 years, she has been having knee pain that just doesn't go away. Over the last 5 years, her pain is getting much worse. She has stopped walking to work because the pain ruins the rest of her day.
You are just getting old.
She doesn't like feeling old. Definitely doesn't want to take pain pills every day. She Googled her symptoms. Sounds like meniscus problem. It isn't recommended to operate on these anymore. She rings her cousin, a physiotherapist, and gets a training program. Britt has been following her exercise program for 6 months now, 3 days a week. But she is no better. Pain is getting worse. She books an appointment with her doctor.
It's arthritis.
And send her for x-rays. 2 weeks later, her doctor...
Arthritis in both knees. You need to train.
Last 6 months. Can we operate?
No, we would have to remove the whole joint and give you a prosthesis. And you are way too young for that. Remember, the prosthesis will wear out after about 10 years, and then what do we do?
Britt walked out, confused and upset. What am I going to do? She rang her cousin, but isn't there something else you can do? Well, there's a clinic in Lillison that specializes in using stem cells to regrow cartilage and damaged tissue. I don't know much about it. It is really cutting-edge stuff, but it is safe. Worth a try. Who was Britt going to trust? Why had her doctor not told her about this? How much pain was she willing to live with? She Googled Phoenix Health and rang them.
We want to make sure that we recommend the right treatment for the right patient at the right time. And so we make sure we always do this. We always treat every patient like they were our grandparents.
Dr. Wilson went through Britt's medical history. Jeremy gave her a biomechanical assessment. And together they went through her x-rays.
Has anyone explained to you what arthritis is and why you have pain?
Well, not really. Just that I'm getting old.
I want you to imagine you have an army in your body that repairs damage. This army is led by your stem cells. Every day, forces from movement are damaging your knees, but the knee stem cell army is fixing the damage. As we get older and use our joints more, our stem cell army starts to not function as well as it used to. A new army starts to invade, the arthritis army. The arthritis army attacks the cartilage walls, and while your stem cell army does its best to fight back and rebuild these walls, over time, the arthritis army grows stronger and becomes too much for the stem cell army to deal with. They become overrun, and that's when the pain comes. How important are your knees to you? What do you want to be able to do?
I would love to start walking again, skiing, getting into the mountains. Even just not feeling like I needed to take painkillers.
Well, if that is the case, and because you are over 50, I don't think PRP is going to be strong enough. We should do our stem cell transplant protocol on you. This is where we take an army of stem cells from around your belly, and we transplant them directly into your knees. What is amazing about this new army is that it is young, strong, and most importantly, can fight and function the same way your knee stem cell army used to 20 years ago. Then, we are going to stimulate this new army, and over the next 1 to 6 months, give you PRP injections. These are like a food and supplies delivery to this new army, so that it can continue to grow and fight. Think about it, and call us when you need us.
Britt drove home. She was still confused, but with a glimmer of hope. Why hadn't her doctor recommended this to her? Who was she going to trust? What would happen if she did nothing? How much pain was she prepared to live with? How amazing would it be to get back into the mountains again? To ski, lose that 5 kilograms she'd put on the last 5 years. At least the treatment would take out some of that fat, she laughed to herself. Back and forth in her head a dozen times. She even dialed the number twice before getting scared and putting the phone down. 3 weeks later, Christine rang. Mama, Espen has lost his job. He's going to have to go back to working offshore, and I'm pregnant. Britt was filled with excitement and fear. She was going to be a grandmother again. But with Christine being alone with the kids for weeks at a time, she would need to help out a lot more. How can I run after 2 grandchildren when I can't even walk to work? It was time to do something. She rang Phoenix House the same day. First week after treatment was rough. David had told her it would be. She could feel things were happening.
Remember, no quick fixes, just fast results.
And they were. Britt raced to the hospital when she got the call. It's a girl! Up the stairs, doesn't need the elevator anymore. Briskly, she walks into hospital room to meet Celia. She holds her granddaughter for the first time. A smile erupts over her face and could break into tears at any moment. In comes John, Espen, and Bjornar to meet Celia.
Can we go skiing today, Grandma?
As they walk back to the car. Of course.
Grandma, why doesn't Granddad come skiing with us?
Because he is getting old.